So we are still reading the guidelines for mpox on the CDC webpage. Today is August the 18th, and this webpage was updated on March 15th, 2024. I am reading this on Sunday, August 18th, 2024. I am in Columbia, Missouri, in the US. So it says here, safer sex, social gatherings, and mpox. How can a person lower their risk during sex? Vaccination. Vaccination is an important tool in preventing the spread of mpox. Jynneos is a 2-dose vaccine developed to protect against mpox. Getting both doses provides the best protection against mpox. People who have only received 1 dose should receive a second dose, even if it has been longer than 28 days since their first dose. If you are at risk for if you are at risk for mpox but haven't received your 2-dose vaccine yet, temporarily changing some parts of your sex life might reduce the risk of exposure to the virus. Reducing or avoiding behaviors that increase risk of mpox exposure is also important when you are between your first and second shots of vaccine. Your protection will be highest 2 weeks after your second dose of vaccine. And I'm still continuing to read from the CDC page. Make it a habit of exchanging contact information with any new partner to allow for sexual health follow-up if needed. Talk with your partner about any mpox symptoms and be aware of any new or unexplained rash or lesion on either of your bodies, including the mouth, genitals in this case being penis, testicles, vulva or vagina, or anus or butthole. If you or your partner has or recently had mpox symptoms, or you have a new or unexplained rash anywhere on your body, do not have sex and see a healthcare provider. In some cases, symptoms may be mild, and some people may not even know they have mpox. If you or your partner has mpox or think you may have mpox, the best way to protect yourself and others is to avoid sex of any kind, whether it's oral, anal, or vaginal, and kissing or touching each other's bodies while you are sick. Especially avoid touching any rash. Do not share things like towels, fetish gear, sex toys, or toothbrush. Even if you feel well, here are some ways to reduce your chances of being exposed to mpox if you are sexually active. Take a temporary break from activities that increase exposure to mpox until you are 2 weeks after your second dose. This will greatly reduce your risk. Limit your number of sex partners to reduce your likelihood of exposure. Spaces like backrooms, saunas, sex clubs, or private and public sex parties where intimate, often anonymous sexual contact with multiple partners occurs are more likely to spread mpox. Condoms may protect your anus, mouth, penis, or vagina from exposure to mpox. However, condoms alone may not prevent all exposures to mpox, since the rash can occur on other parts of the body. Gloves, latex gloves, might also reduce the possibility of exposure if inserting fingers or hands into the vagina or the anus. The gloves must cover all exposed skin and be removed carefully to avoid touching the outer surface. Avoid kissing or exchanging spit, since mpox can spread this way. Masturbate together at a distance without touching each other and without touching any rash. Have virtual sex with no in-person contact. Consider having sex with your clothes on or covering areas where rash is present, reducing as much skin-to-skin contact as possible. Leather or latex gear, latex gear also provides a barrier to skin contact. Just be sure to change or clean clothes, gear between partners and after use. Be aware that mpox can also spread through respiratory secretions with close face-to-face contact. Remember to wash your hands, fetish gear, sex toys, and any fabrics, bedding, towels, clothes after having sex, right? And of course, you must also make sure to seek your healthcare provider if you suspect that you have mpox, right? Let me see what else I can pick up here from the CDC website in terms of monkeypox. So what they really emphasize here is in terms of prevention and control of mpox, vaccine information. When properly administered before an exposure, vaccines are effective at protecting people against mpox. Caring for patients with mpox, key characteristics for identifying mpox. CDC urges healthcare providers in the US to be alert for patients who have rash, illnesses consistent with mpox. All right, so if you are having any suspicions that you may have mpox, see your healthcare provider. All right, my friend, that was some of the updates, the signs and symptoms from the CDC webpage in context to mpox.